to begin the next speaker, let me introduce. She is Dr. Sónia M. Rodrigues Oliveira, CICECO-University, in Department of Medical Science. She has published many research papers in reputed international and national journals. She is very good educator, very good researcher, and let me tell you one thing, a very, very loving. It indicates that family can go along with your research, your work. Thank you so much. And now I would like to call upon her on the dais to deliver her talk. And the topic is biology mimicking system to fight diabetes.
Hello everyone. Oh, this is really hot. Sounds really high pitch. Okay, so thank you so much, Professor Sunil. So like he said, I'm going to talk to you a little bit about the biology mimicking systems, in this case to try to fight off diabetes. So just a little bit where I come from. This little corner of Europe. No, we are not next to Brazil, you all know there, but I've met Americans that thought we could take a car to actually meet. Just saying. So I come from this little city called Aveiro, near Porto. It's about 1 hour drive from Porto. It's the city of the channels. They like to be called the Venice of Europe, of Portugal, sorry. Well, at night it's really beautiful, I can tell you that. And this is our campus, and this is the building I work on. It's a CICECO. We have different groups working together. There's people doing exactly, not exactly, but similar to what Professor Wang does. In my case, I work more in the biomimetics, so more nanotechnology with the line of sustainability and health. And this is why we took this line of work, because of sustainability. So this is just a ramble of words when you think about biomimetics in diabetes. It's just not the insulin, it's just not diabetes. It can be nano micro applications, it can be personalized medicine, and this is what we are looking after. I think we are changing a little bit when it comes to medicine as well. So, just a little background. We did this publication from actual final year student where we focus on type 1. I think all the presents here know that type 1 and type 2 are very, very different. And in fact, all the mechanisms associated with either one of them is rather unclear. So although diabetes has been around and treated with mostly insulin for quite a while, the fact is that we don't know everything about it. In fact, we don't even know the onset and the etiology of it. This is the course we organized with Professor Ana Paula. I'm not sure if anyone present was there, but basically we tried to connect obesity, diabetes, and reproductive health. And I understand that a few years ago, people, particularly in the preclinical setting, didn't like to cross lines of work or branches, but the fact is that our body is a perfect machine. It has thousands and thousands of years of evolution, and if one thing goes, amiss, everything starts to fall apart. So this is the case for obesity, that can link to diabetes, that can link to your reproductive health. And finally, just a presentation we had last week at the European Nights of the Researchers, where they are trying to pay us some tribute for all the efforts, because I think all the researchers in here, they can tell you it's not easy to juggle family life with research, and much less to think that you have a 9-to-5 job. Okay? So, the diabetes changer. IDF predicted in 2021 that about 10 to 11% of the population, the adult population, has diabetes. Most of them don't actually know it. Actually, I just met a technician up there during the short course that was telling me that it was by chance that he found out he had diabetes while poking on a rat, and when he went to the blood analysis of the rat, the glucose was actually his high levels, not of the rat, and that's how he found out. Before that, he had no signs or known background history. So it's predicted by 2045 that 1 in 8 adults will be living with diabetes. That's almost a 50% increase from now. WHO says that basically 108 million in 1980 turned into 422 million by 2014. Now, people tend to blame this on diet. Would it be just diet? Another thing associated with obesity, of course, would be side effects like blindness, kidney failure, heart attack, stroke, or even lower limb amputation. And I didn't include here, but then you also have the side effects of the medication for long periods of time. So this is just a map showing the incidence or prevalence of diabetes in 2021. Usually people tend to associate the diabetes with the Western diet, so all the Western so-called countries. But the fact is that even Africa and Asia are getting high levels of diabetes diagnosis. So in the old days, we tend to blame it to the urbanization, aging of population, overweight, lack of physical activity. This would be the norm. Every doctor would know this, everyone would know this. But in fact, I believe these are not the sole culprits in here. Then, of course, you have gestational diabetes. I'm not going to go there because it's a particular case for pregnant women, type 1 and type 2. And if you are working anywhere near a clinic, which you are, you probably know that type 1 diabetes that is usually only attributed to genetics, it's also in very high rise in terms of diagnostics. So it might be epigenetics effects. I think it's so much more, probably. So there's here a dangerous breakdown. So although we continue to be taught that it's only the Western culture, all the sedentary habits, the food we intake, then how come the low and middle income countries, and particularly countries that have a very traditional and sort of healthy food habits, continue to get such high diagnosis of diabetes? So something is missing there. There's something that is not right. In terms of course, I would say you have to keep on making healthy food choices, being physically active. Then you have the stress. I mean, this is not part of our research, but just an highlight here. You really have to take care of your mental health and cope with stress because of your cortisol levels. Cortisol can also lead in long term to the development of diabetes, not just obesity. And I think stress is still very overlooked in our societies. And it doesn't matter where you come from. It doesn't matter if it's from China, from Thailand, from Portugal, from United States. Nowadays, there's a lot of pressure in most of us. So, but in terms of technology, of course, most of the research has gone to trying to establish partnerships to get data, particularly when it comes to computational methods or bioengineering. And then you have the evidence-based telementoring program. Most of the medicine today is, of course, evidence-based. Now we are trying to get a shift towards a personalized, a more individualized medicine. And we also trying to get the pharmacy departments to get involved. I think there's some disconnection in the clinic between all the ones involved in the caring for patients. And we need to basically make a connection here and collaborate. So this is also happening in research. There's different lines of research when it comes to biomimetics. You can try to develop a microchip or bioreactor to just study how diabetes develop, or the treatment or the influence of drugs, or individualized molecules. You can try a nanoparticle formulation for the drug delivery that you already use. It doesn't matter if it's metformin or other. And then you have the advanced cell culture. There's a whole different line. However, it's very important for the other two that I just mentioned. But in the end, we also care for sustainability. And we've been caring for a while before it was a fad called by the United Nations or anyone else. So we never kept our eyes too far from natural-based compounds. So in here, I'm going to focus on plant-based. However, in my research, I also looked to other biology systems. You can think of marine sources like crustaceans or algae. Particularly algae now again are becoming a main focus. So biomimetics consists in the design, development, and applications of technologies to trying to mimic or resemble in any way the biological organisms or single process or systems. I believe that the goal would be the organisms because I believe in the synergy between the whole organ systems, like I just said before. So the aim of developing this is to try to leverage the efficiency, functionality, sustainability, and of course, while innovating, but keeping an eye on the traditional practices. By the years, most of the researchers focus on the artificial pancreas or pancreas on a chip for the studies in bio-inspired drug delivery. So I'm gonna go over there a little bit. So this is what I just said, why using biomimetic systems. So it started with things as simple as looking at gecko hands and why it doesn't fall off when they are, on the ceiling and stuff like that. What do they have on their paws that we can mimic to create things like that? So that's how basically biomimetics were born. And today we trying to look at this biology background to then develop personalized therapeutics. The nanotechnology comes to give a side help into it, particularly when it comes to the drug delivery part, and to enhance the precision and efficiency of that delivery. And finally, in the part I care most, the advanced cell culture, to study the cell responses of any compounds we use in there. So this is what has been created thus far. We're trying to design insulin delivery systems and developing glucose sensors. So nowadays, it doesn't seem like it, but 20 years ago, there was none of it. Now a person can basically have a pancreas replacement, just like this, installed into them. I know that in the States has been approved in 2016. I'm not sure here, certainly not happening in Portugal yet because it's too expensive for the government. That's basically it. However, I think in terms of life quality, would be much important to continue to look at this, particularly when together with glucose monitoring. This is just a prototype here on the right of needle-free continuous glucose monitoring. The ones they apply nowadays continue to be needle-based, so the person is really packed on the skin, and they have to change it every 1 or 2 weeks, and it's painful because then you can develop wounds and stuff like that. However, if you're trying to figure this out in a biology-inspired way, how the animals work, like the mosquitoes, how they picked on you, they live, what hurts you is not the actual bite, it's the things that they inject on and how the spike is formed. So if you can overcome that, you figure out a system that doesn't really hurt you and gets you into your bloodstream as well. This is the objective for being non-invasive, personalized, trying to get cheap as well, and continuous on time. This was just on the news, probably we are in October, so last month, developed by MIT. They patented it, an implantable device to carry hundreds of thousands of isolate cells along with its onboard oxygen factory. So the main issue so far, or so most people think, is that isolate transplants don't work because somewhere along the way, the cells don't survive due to the lack of oxygen. Might be that, might not be, but this has been currently going into near clinical trial testing. So basically this little thing that looks like the SIM card in your phone has integrated a continuous glucose monitoring system, a control algorithm, an insulin pump, and also a 3D cell culture system going on. It's tiny, right? It's impressive. I thought it was impressive. So this is the most developed artificial pancreas so far that can go on the market. So when you talk about artificial pancreas, and this is where I think that system that I just mentioned is not complete, you have all these areas. You have to think about the cell culture in expansion, just like they did when it comes to oxygen, but maybe not the nutrient part. The decellularization, this is important when it comes to scaffolds. So they put the isolates there in an organoid shape. Isolates don't live in the pancreas in an organoid shape. That might be a downfall, but don't mind me, I'm always a critic on certain things. Then you also have to care for the chemical and physical characterization of the biomaterials, which they did. So any molecule you use, any material, has to be fully characterized for things like charge, ligand distribution, solubility, stiffness, roughness, biocompatibility is there as well. And then, of course, it comes to the 3D assembly of the material. And finally, also in vitro testing, just to make sure, although in vitro doesn't really mimic too well, and we know this nowadays, what's happening. So this is just a summary of what I just said. I think to get the unified pancreas system, we really need all these 5 areas to be fully developed. This includes the functional testing, and I think we fail here when it comes to the unification of protocols between researchers. I think we need more collaborations when it comes to this. There's sort of a competition between labs that I don't think it's fruitful. I think it's better to just talk and discuss and see what one does better and the other one does not so good, and trying to reach to a middle point, a balance, to get this part going. Because right now, there's plenty of tests that are standardized, but the fact is that only about 5 to 10% of everything we try gets to the clinical trial stage. So we are wasting resources. We are not being efficient. And that's what I want to avoid. I don't want to waste so much money before actually going to this stage. Then you have the cell culture, still ongoing research, or more recently, we are actually going into the 3D models creation. And finally, the biomaterial characterization, 3D assembly, and scaffold generation that usually work together. So this is when I start to look at microfluidics for testing, particularly for testing pre-in vitro. So in this field, we focus on the behavior manipulation and control of the fluids at a very, very tiny scale, usually a micrometer, to control the environment and create a miniature model that can be versatile, interdisciplinary, precise, basically a lab on a ship or an organ on a ship. So we want to create something that includes the cell culture, besides the gradient, the perfusion and flow is basically what defines microfluidics, the cell matrix interactions, and in here we don't have, well, I mean that the literature doesn't have that much advance going on. I think most of the things published in microfluidics don't actually have the matrix in consideration. However, and coming from a cancer background, the microenvironment involving any cell is of extreme importance. And then we eventually will go to, the drug testing and the cell cycling studies. So in here I just summarize all the advanced cell culture branches that people are working on. In my case, I work on isolate encapsulation, but you can also think about the issue of mimicry, biomaterial scaffolds. So there's a new technique called clearing, which is pretty much put the cells inside the tissue to sleep, not fully described. So there's decellularization, where only the matrix is left and the cells die off and are washed out. In this case, you basically put them to sleep and they are not reactive, so they are not expressing any proteins or genes. And then you have to care also for the immune modulation and vascularization strategies. And finally, only then the in vitro testing and looking for patient-specific approaches and regenerative potential. And this can actually be done if you get access to patient biopsies and cultures and whatnot, which in Portugal is very difficult, let me tell you, because of the ethical approval. So finally, I get to the plant-based compounds. And in here, it's a cheap source, and you get easy access without worrying about the ethicals. So these are a few of the species that are on the literature mentioned to be very fruitful, very useful to treat diabetes. Curcumin, I saw some by selling down there, so all of you should know. Resveratrol, so associated with wine, but it's not wine, just in the grapes and the seeds. And then berberine, cinnamon as well, is very good to mix with coffee, let me tell you, to control your blood sugar. And then the fenugreek seeds, bitter melon, and Gymnema sylvestris as well. Other species that were identified to have some sort of component that have very anti-diabetic or insulin-mimic effect. This is a paper just describing what cinnamon can do in terms of mechanism of the cell. This is postulative. So basically, the isolated biocompounds on lipid metabolism in the intestine can affect the bloodstream glucose and like that control the glucose in your bloodstream. This is just a summary of pretty much what I said, just giving an highlight to all the pathways involved. So you can see by so many dots and by so much text that we have a lot of pathways to go through when it comes to diabetes. However, we don't actually really know how they interact with themselves. But they certainly do, because if something goes awry or wrong, some other pathway will get activated. We don't really know the cofactors involved in there. Finally, and this is what we want to do with some collaborations, of course, the integration of all these innovations. So we want to integrate the biomimetic systems. It doesn't have to be the artificial pancreas. It can be just a physiological mimicking insulin management system, which is basically what we are after, not so much the artificial pancreas. We tested all the plant-based compounds that we recognize or select at the microfluidics scale, then associated it either to cover the nanocapsule or to actually integrate in the biophospholipid membrane so that the body basically doesn't reject it and gets internalized more easily without the rejection from the body. So immunomodulation type of basically mechanisms. Finally, we also want to integrate some cells, some in vivo typical cells from the patient to also increase the biocompatibility and decrease the rejection chances. I already mentioned the plant-based compounds, and this will finally create the precision medicine approach that we want. Of course, the result of this, so in terms of future prospects of this type of research, there are people working on wearables and implantable device, that's what I showed before with the pancreas attached, but also for the early diagnosis, personalized treatments, and finally, a cure, at least a manageable cure. And this is just a summary of what I said and I talked about. So the biomimetics incorporate the nanotechnology to test and refine the designs. The nanotechnology is just to get it more efficient delivery, avoid side effects, get to the target before it gets, wasted in the body, because even the acid in your stomach is immune modulator to everything it gets inside your body. So we need to overcome that barrier as well. And the advanced cell culture methods to test the plant-based as well before we get the authorization to move to the nanotechnology. And those have to be, besides integrated or incorporated, also have to be characterized in case they are new, which in our case they are not. So I want to thank you all. I hope I didn't take too long or bore you too much. And thank you so much, Professor Ana Paula and Andrea, although you're not here, and all of us in the lab and all the collaborators. Thank you.
Thank you so much, Dr. Sonia. It is indeed very elaborative, very interesting, and very new approach to deal with the diabetes. And now let's take some questions from the audience. Yes. In fact, you want to ask question in your own language. She will, yeah.
Se alguém tiver alguma pergunta para fazer, né, em português, eu traduzo para... Ela é portuguesa, então ela fala português. Então, se vocês quiserem, estão em casa.
So I have one question that you artificial this pancreas, you have created some artificial pancreas. So how do it goes for the patients? Do you seriously give to the patients? Do patients apply it for the cure of diabetes?
This is not at the cure stage yet. It's just to basically avoid that every day, every meal puncturing with insulin. So in fact, it's not a cure. It's just trying to get a manageable way that give better quality of life for patients without them carrying to, poke their finger to measure the glucose and then injecting the insulin. It's basically trying to get around the multiple poking of insulin. So it's a technology base. There's no biology, no preclinical testing involved behind it. It's fully technology, and there's no chance of cure there.
Thank you so much. Would you like to ask a last question, if you have? Thank you so much.
Thank you.
Thank you so much.